Please help me welcome Datuk Dr. Selvam on Glutathione.
Good evening. So how was the lecture for today so far? How many of you all are doctors here? So if there are non-doctors attending, it's a good sign that Saham is growing and we are able to make a difference in influencing you to attend the talk or this training, module 1 to 6. Of course, it's going to be overbearing, especially the module 1, because there's a lot of complicated pathways. We call it biochemistry. Some of it will look like a jargon that even doctors find it difficult to understand. We may have studied this 30 years ago. We need to keep looking at it again and again and again to remember. Try to absorb what you can. Some of the simplest things that might help you to make a difference in your own lives and the lives of those around you and those who seek your help would be to advise a healthy diet. And along the way, you will also learn a few basic supplements would be necessary. You will be taught about detoxification, how to improve your immune system, what are the antioxidants, what are the roles. So try not to be overwhelmed. What you can, you learn and remember, and you have the notes with you. The best time to read and remember is within 24 hours. So whatever lectures you have attended today, if you can go back and read, then it becomes long-term memory. Otherwise, it may remain as short-term memory for a short period of time. Okay? So this lecture is slightly different from the rest of the lectures that you have heard today. This lecture will reinforce on 3 of the most important health pillars. One is your immune system, the other is your antioxidant system, and the third is your detoxification system. These 3 pillars of health are extremely vital to maintain good health, to prevent disease, and help those who are sick and even reverse diseases. But of course, there are other pillars of health. You should first start focusing on diet, and it's very simple. Just remove certain food from the list of foods that you like to eat or you want to keep eating. And that applies to your children and everybody around you. First thing is remove the gluten. If you are not sure what is gluten, please read. Number 2, remove sugar, all forms of sugar. Whether it is brown sugar or white sugar, brown sugar is better than white sugar, but a devil is a devil. Whether you dress it in white or black, is still a devil. The third is remove dairy products. Of course, you have to remove trans fats, anything that you find on the shelves. Remove the killer food, the soft drinks. Yeah. So this would form some advice on diet. And what you can eat is very simple. 60% of what you have on your plate must be vegetables. 20 to 30% you can have it as proteins and oils. Choose eggs and fish as protein. Nuts give you a good source of protein. Avocado is a good source of protein, oil and minerals. And the oil that you can use it on the food and for cooking would be coconut oil. And that can be used, you can drink actually coconut oil. It's a very good health food. And for cooking, Indians like to use ghee. You may want to experiment. Do not buy any other oil. You are buying sickness. Olive oil used to be okay in this country, but I don't think you get good oils anymore unless you are able to find a good source. Then of course you got to choose the right type of olive oil. So it's simple if you keep it to coconut oil and ghee, if possible. Okay. So, sorry? Unrefined palm oil, the problem is it is heated, right? To prolong the shelf life. The problem with oil is when it is heated. If it is not heated, it's fine. The whole idea is to stay away from deep frying. You don't get, if you want, we shouldn't be looking for reasons or excuses to deep fry. Well, of course, anything that I say throw once in a way is still fine. If you want to use it, because of course palm oil can withstand temperature slightly better than trans fats. Coconut oil stands high temperature better than that. Ghee is even better. You can use organic butter. Yeah. So this is better. So any oil that has not been heated before it goes onto the shelf would be better. And why do they heat is to prolong the shelf life. So only 10 to 15% is your carbs. Okay? And you don't have to eat carbs for all the 3 meals. If you want to live longer and healthier, leave the carbs for lunch. Breakfast and dinner have something like a keto diet, but with vegetables. So you can have 60% vegetables, 40% oils and proteins. You will still be fine. You don't need carbs to live. And the carbs that you can eat would be rice-based or quinoa, not gluten. So this is diet. I'm just giving you an introduction because otherwise you will be lost and where to start from. Look at some useful supplements. One of that would be glutathione, another one would be vitamin C, the third one would be vitamin D, the sunshine vitamin, not D2 but should be D3. The third one would be omega-3, either it is fish oil or krill oil, and have a special one, curcumin. Curcumin helps in every single cell in many possible ways to keep you healthy. Yeah. So this is supplements, and of course we'll train you. We'll expose you to some knowledge on hormones, which are very useful, very important. And the rest of it will be covered here. Use the rest of the lectures that you have learned so far as a basis to add on what I'm saying today. Okay? So let's look at glutathione. Yeah.
So again, these compositions of veggies and protein and oils and carbs is like to cross-border on kids or older people?
Younger people, children who are especially very active, they eat more carbs. It's fine. But the type of carb matters. The carbs that can be eaten with less problem would be rice-based and quinoa, not the gluten-based. Okay? You reduce the carbs, or some meals you skip the carbs. Protein is fine. You need protein. You need protein. That's what I said. You have eggs, you have fish, you have avocado, you have nuts.
But the percentage, 20 to 30%.
Generally, you can take about 1 gram per kilogram body weight protein. Yeah. Okay, now glutathione, we call it the sentinel of life. You will realize as I go along why we call it the sentinel of life. This is a simple diagram for doctors. Some of you may think this is very complicated, but this is what you have inside your cells. It's not all the components, but some of the major components inside the cell are here. And one of the most important is this called mitochondria. This is where all your food is burnt for energy. Every cell in your body can only live and function if it has energy. There is no electricity, there is no light. Same way with your body. There is no energy, there is no health. So your food is burnt here, and to burn the food, you use oxygen. So when you breathe, the oxygen is also used here. Of course, every other component is very useful. But mitochondria forms the basis. I may take a little bit longer. Let's see how it goes. I usually don't like the timing at the back. Then it becomes more relaxed, otherwise you rush. Okay. So mitochondria is a very, very important component of the cell, because if you breathe oxygen, you form what you call as free radicals. If you burn the food, you also produce free radicals. And a lot of things in the body produce free radicals. Heavy metals, for example, if you have infections, a lot of it is free radical. Now, how many of you haven't heard about free radicals? All of you all know, right? Okay, they are like poisonous darts. They keep hitting everywhere, and they are like darts who want to find a partner. You can call them the single frustrated people. So they need to marry. So when they want to marry, they will look for a partner. So in that process, they keep hitting at cells. And this is the damage to the cell, especially to the mitochondria and your DNA. Because free radicals, as I mentioned, in the process of your digesting and utilizing your food, your breathing, any infections in the body, if you have heavy metals like amalgams, or you are not aware if you have lead or mercury in your body, they create free radicals, and they almost all of them happen in the mitochondria. So there are many types of free radicals that damage. They are reactive oxygen species and reactive nitrogen species, and they affect cells and their function in different ways. So basically there are two types of free radicals, those of oxygen series, those of nitrogen series. And why they are important is because free radicals, when they are produced and they live for a very short period of time, they are useful, because that is how your body actually kills germs and cancer cells. But the problem is we have too much free radicals, and they persist in the body for too long. Why? Because you have become deficient in antioxidants. So what are antioxidants? They are basically nutrients that reduce or neutralize free radicals. So the moment free radicals are created, as much as possible, most of these free radicals must be neutralized immediately before they cause the damage, especially to your mitochondria. It is not like what we thought earlier, that your DNA is damaged, that's why you get a disease. Actually, the mitochondria gets damaged first before your DNA gets damaged. And this is the origin of cancer as well. So these are the antioxidants that neutralize the free radicals. Of course, there are different types of antioxidants. So you have antioxidants in the blood. So this is water-based. Then you have antioxidants inside the cell. Then you have antioxidants that work on the cell membrane. The cell membrane is a fatty layer. So you have water-soluble, you have fat-soluble, you have antioxidant inside the cell. Is this clear? Okay, now you tell me which is the most important antioxidant, water-based, inside the cell, or fat-soluble? Sorry? Inside the cell or fat-soluble. But where is your mitochondria? Inside the cell or on the cell membrane? Where is your DNA? Where is your nucleus? Where do you make your antibodies? Where do you make your proteins? Where do you make your enzymes? Everything happens inside the cell. So protecting the components of the cell from free radical damage would be the most important function of the antioxidant. Every other antioxidant is useful, but the master is the one that works inside the cell. Okay? Now why this is important? Because life is not possible without glutathione inside your cell. Because as I said, even if you breathe, you produce free radicals. But can you live without breathing? Hold your nose and stop breathing for 1 minute and see how you can survive. Now what happened was, life started from a single cell, and no oxygen was used at that time because there was no atmospheric oxygen. As evolution took place, cells started using oxygen. What happened when they started using oxygen? They created a lot of free radicals. And the evolution the mechanism of evolution has to ensure that that cell develops an antioxidant system in order to survive. Of course, it would have taken millions of years. And the first antioxidant that evolved was glutathione. That's why we call it the master antioxidant. So simply put, life is not possible if you don't have glutathione. So if the glutathione is 0, the cell dies. When the cell dies, the organ suffers. When the glutathione level drops, the cell gets sick. You get disease. And we doctors try to fix the disease with drugs. Doctors mean no harm. That's what we study. So we just deliver what has been taught to us. None of this is taught to us in medical school. So this is why we take great pain in educating doctors and non-doctors as well, paramedics. So do you all understand the basis of glutathione? Okay. So what is oxidative stress? The stress that is caused by free radicals and the damage that is caused is known as oxidative stress. So this is the major cause for chronic degenerative diseases, cancers and premature aging. In fact, the wrinkles that you get as you age, it's a free radical damage. Yeah. So one is the food you eat, you will create free radicals, so it's unavoidable. If you have infections, especially in the gut, those of you who have gastritis, who have bloating, reflux, lots of gas, white-coated tongue, women who have vaginal candidiasis, all these are signs that you have infection in your gut. And most of it is fungus, not bacteria. So they cause a lot of free radicals through inflammation. So this has to be treated. That's why I always focus on treating the gut before I treat the rest of the problems. Exposure to toxins, you have lots of toxins. You have pesticides, you have herbicides, you have in the form of detergents, air fresheners, and you have a lot of heavy metals. Lead and mercury are toxic, especially mercury is very, 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 very toxic. And where do you get it from? If you eat fish, I'm not saying stop eating fish, at least stop buying big fish. Buy the small one. Then you are safer. Never have amalgams. If you have, please remove it. And you can show me every half an hour. You show me every 10 minutes is stressful. Remove your amalgams, see a biological dentist. And children, when they are vaccinated, those vaccines have aluminium and mercury. Is that shocking? Every vaccine has aluminium, every vaccine has either aluminium or mercury. So a child by the age of 1.5 years would have received at least 38 vaccinations now. So do you think you will escape from heavy metals? So if you can detoxify the heavy metals would be good. All kinds of infections and the infection that happens in your gut, the mouth, even if you don't have any symptoms, would also cause a lot of disease. That's why nowadays we know if you have especially chronic gingivitis, it is associated with increased risk of not only heart disease but also cancers. Because it's inflammation, and inflammation creates free radicals. Physical and psychological stress. If you have physical stress, like we sit from morning till night, carpet, all the gas around curtains, if you don't take enough vitamin C and glutathione, you'll feel tired after 3 days. You may have come down with a flu. The same thing with psychological stress. Acute psychological stress will also make you sick because they create a lot of oxidative stress. So there are different types of free radicals. One is superoxide anion. It's just oxygen with extra electron. So it's not O2, it's actually O3. But it's not ozone. Okay? So this is one type of free radical. Then you have hydroxyl free radicals. This is the most dangerous of the free radicals. If water is H2O, the hydroxyl is OH. Only an H is missing. So this is the antioxidant. The H, if it is added, it becomes water. Then the free radicals is neutralized. Am I right? So this is how antioxidants work. They contribute an electron and neutralize the free radical activity. The third one is singlet oxygen and hydrogen peroxide. Hydrogen peroxide is not very toxic. Body generates to kill bacteria and cancer cells, and it lasts for a short time. So these are oxygen species based on oxygen. You also have nitrogen species. You have nitric oxide. Nitric oxide is actually very useful molecule because it causes vasodilatation, helps with blood flow, but it can become a free radical, especially when the superoxide anion combines with NO, it becomes peroxynitride. So there is ONOO. So this is again a toxic free radical. Now most of these reacts with metals like iron, copper, fatty acids and LDL. So what's the difference? Iron is found in your hemoglobin. If you have too much free radicals, it affects even your hemoglobin. So you don't have the oxygen carrying capacity. You have reduced oxygen carrying capacity. This is why many people, when they replace or increase the glutathione levels, they have more energy, simply because it helps them to carry more oxygen. Okay. The problem also is it reacts with fatty acids. Fatty acids are the ones that are found on your cell membrane. So if free radicals damage your cell membrane, the cell membrane becomes harder. So not many vitamins and minerals and your hormones will get into the cell, and the cell cannot detoxify. And of course, your cholesterol. Never get alarmed about cholesterol, because this is a ploy to sell statins. Cholesterol will get higher if you have infections, if you have heavy metals, if you have low glutathione, if you are aging, if you are pregnant, because cholesterol is needed to heal. Cholesterol is a healing molecule. Only when it is excessively high you need to worry. Only thing about cholesterol is you have enough of glutathione and vitamin C to protect it from getting oxidized by free radicals. That cholesterol is safe. So the last blood result that I want to see when I do my own test is cholesterol. Sometimes I don't even bother looking at it, because it doesn't really matter as long as you have antioxidants. So if you talk about superoxide anions, that's the one I said, oxygen with an additional electron. It is formed when oxygen is utilized. So every time you breathe, you produce superoxide anion. Okay. So all cells using oxygen are exposed to superoxide anion. So this is a universal free radical in your body. So breathing, your immune system, when it acts against any kind of germs and viruses and fungus, you produce superoxide anion. So without immune system, we are not going to live. But the function of immune system itself will create free radicals. So the body is very intelligent to create an antioxidant system inside the cell that to neutralize all this. And so on, and your energy synthesis in the form of ATP, all this generate superoxides. Okay, so you need 3 electrons to neutralize 1 superoxide because it has got an additional electron. So what it means is, when you have superoxide anion, you need more antioxidants. Is that clear? Okay. Then you have an antioxidant, it's called SOD. How many of you have heard about SOD? Superoxide dismutase. Has anybody not heard about it? There was a few years ago, this African tea was very popular. I forgot the name. It was supposed to contain SOD. SOD is actually an antioxidant inside the cell. I'll show you there are 3 types of antioxidants. Basically, this is a very important antioxidant system, and it protects all the cells that are exposed to oxygen. Okay. What it does is, it reduces the superoxide anion into oxygen and hydrogen peroxide. So they become, oxygen of course is not toxic, hydrogen peroxide becomes least of the problems for you. So SOD or superoxide dismutase is an intracellular antioxidant that is very, very important. But we are not talking about SOD here because SOD can be activated by other antioxidants. Okay, so consuming SOD is not a very useful thing to do because it's difficult to get absorbed. Then you have hydroxyl. This is OH and it is the most vicious. How do you neutralize this? This is a free radical. Though it is the most dangerous, it cannot be neutralized by SOD. It can be neutralized by glutathione, and this is an error. It's supposed to be hydrogen ion. Okay? Change it, Yamana, in this slide. So this glutathione and hydrogen ion neutralize hydroxyl free radicals. Okay? So what is the difference between glutathione and hydrogen is, have you all heard about hydrogen as an antioxidant? Have you all heard about hydrogen water? Yes? So when you drink hydrogen water, that's a good thing to do, in my opinion, because you drink water throughout the day, not at night, but throughout the day, right? So you have hydrogen most part of the day. Cancer patients, I let them breathe hydrogen gas for 2 hours whenever they come for an infusion. But to take oral hydrogen, the disadvantage is it's a gas. It goes in, does its job and is gone. So you want to have benefit of hydrogen as an antioxidant, you must take frequent dosing every 4 to 6 hours or even lesser. And the benefit can only be seen after about 6 weeks. It's not so quick. Okay? So if you were given a choice, I would take something that controls everything as I'll show you. You understand the difference? Okay. So how do free radicals, another way they affect is, as I said, they react with the lipids that's around on your cell membrane to form another free radical called lipid peroxides. The problem with lipid peroxide is they work with iron, which is in your hemoglobin. They work with copper, that is very, very necessary, but taking extra copper will cause cancer. But they work with mercury. So at any possible cost, you must remove mercury from the body. Whatever that you are exposed to, that you know it's in your body, like amalgams, you must remove. And you must regularly have an agent that detoxifies your body by removing heavy metals as well. So you need these 3 pillars of health as I mentioned. Oxidative stress. So free radicals, this is the oxidative stress. What does it do? There is another big problem with oxidative stress and free radical damage. They increase the risk of cancer. In your body, the cells, aging cells undergo self-death. Okay? They commit suicide. We call it apoptosis. When you have free radical damage, they slow down the apoptosis. That means your cells live longer, which means higher risk of cancer. And they also increase a factor called nuclear factor kappa B. This is a master inflammatory signal. When you turn on the NFKB, all your inflammatory cascades will be activated. So it's dangerous to have too much of this factor, NFKB. And free radicals increase kappa B. So you have an increased risk of cancer. COX-2 is an enzyme that also is involved in inflammation. Chronic inflammation leads to free radicals. Free radicals leads to depletion of your antioxidant. So chronic inflammation is another underlying cause for almost all the diseases along with high insulin levels. Just remember this, and you may want to Google and read about hyperinsulinemia. Another way free radicals increase cancer risk is by increasing what is known as VEGF. Yeah, it's vascular endothelial growth factor that increases angiogenesis, new vessel formation. If you look at cancer pictures, there is always like a crack and lots of blood vessels, right? That is called angiogenesis. New vessel. Why cancer form new vessels? because they can only live in the absence of oxygen, but they need a lot of fuel. So the blood vessels will take fuel for them, and they only eat sugar. Another free radical is methyl glyoxal. This is a byproduct of your metabolism. That means the food you eat. You get more of this if you eat more carbs and barbecued food. Yeah, and this again is detoxified by glutathione. So we talk about glutathione now. That was just an introduction. Okay. Now, hydrogen peroxide and lipid peroxides are catalyzed, that means neutralized by glutathione and an enzyme called glutathione peroxidase. So I told you all the different types of free radicals. So you have hydrogen peroxide, not much of a problem. Lipid peroxide is a problem because they oxidize, including your cholesterol. So that is neutralized by glutathione. Organic peroxides reduced by glutathione as well. Inside your cell, you have three antioxidant system: glutathione, catalase, SOD. Okay. Now, catalase, when it is activated by glutathione, neutralizes your hydrogen peroxide. You remember the different types of free radicals? So, hydrogen peroxide is reduced by catalase. Who activates catalase? Glutathione. SOD neutralizes superoxide anion. Who activates SOD? Your glutathione. So who is the master? This is the reason why we called glutathione as the master antioxidant. Okay. So this is how SOD works. It becomes superoxide A, then it clears the superoxide B, converts to hydrogen peroxide, catalase neutralizes this, then it becomes water and oxygen. But this itself has to be activated by glutathione. So the antioxidants I've mentioned, you have water soluble, example is vitamin C, you have fat soluble, a good fat soluble antioxidant is alpha lipoic acid. It's ALA. ALA is both a water soluble, it's the only antioxidant that is both water soluble and fat soluble. Alpha lipoic acid, you can take vitamin E and CoQ10 as antioxidants. The only intracellular antioxidant that is capable of being an antioxidant itself and activating other antioxidants including your catalase and SOD is glutathione. And glutathione is the only antioxidant that can also help to recycle your vitamin C and your vitamin E. Which means if you have enough glutathione in your body, your vitamin C and vitamin E last longer in your body. Okay, so they potentiate each other. So these are the intracellular antioxidant systems that I've mentioned, and glutathione is the master. So what is glutathione? It's the pillar as an antioxidant, so neutralizing free radicals. It is the master detoxifier. So if you want your liver to be detoxified and healthy, you need to have enough glutathione. And is also the master immune booster. This is why the clinical results are seen in all these areas when you have glutathione. Then we discuss about what types of glutathione you can take. So glutathione, as I mentioned, all cells can synthesize and must synthesize glutathione. If the glutathione level is 0, the cell dies. If it is low, the cell gets sick. Liver is the most important synthesis site. 2 enzymes are involved, and these enzymes are selenium dependent. Selenium is a mineral. This is the reason why when you add selenium, the formulation itself gets stronger. Selenium is important part of glutathione itself, and selenium can also help to recycle your used up glutathione. And this is the reason why selenium is a very powerful immune booster. and selenium is very important for ATP production. So it's useful for people with cardiomegaly and congestive cardiac failure. So this redox means neutralizing free radicals or the oxidative stress. It is the key regulator of antioxidant or redox signaling. It is the main regulator of your immune function. It is very important in your detoxification. It helps in control of cell proliferation and apoptosis. So both are balanced. Not too much of premature cell death, that means you are aging too fast. Not too much about cell proliferation, you increase your risk of cancer. So it reduces the risk of cancer as well as reduces the risk of premature aging. This is the balance. So how does it work? It protects against ionizing radiation. All these functions are because it is an electron donor. So an antioxidant donates electron. It protects your cellular and intracellular the components as well as the cell membrane. And remember, there is one thing that glutathione does is it recycles your water-based antioxidants. That means it recycles your vitamin C. And do you all know why vitamin C is very important for health? Anybody knows? Simply because human body cannot make vitamin C. Only animals can make. That is the reason why you do not see animals getting chickenpox, dengue, H1N1, cancer, influenza, Zika, and whatever they create nowadays. Diseases are being created to sell vaccines, I believe. So because our inability to produce. So one of the very important supplement that you should take as a basic supplement is vitamin C. So it recycles the other antioxidants, recycles your SOD and alpha lipoic acid. The deficiency in glutathione level is linked or associated with infective and chronic degenerative diseases. You can Google, there are more than 100,000 articles on glutathione, and the deficiency is associated with about 100 medical conditions. One antioxidant, the major detoxifier, is linked to almost 100 types of diseases. So glutathione and vitamin C are two of the most important water-soluble antioxidants. If you have these two as a combination, you protect yourself against many types of chronic degenerative diseases, infections and cancers. What matters is whether you are taking optimum dose. Anybody knows what is the optimum dose of vitamin C for adults? 6 to 10,000. 5,000 is a good dose. Most people, if they can't afford, a minimum should be 1 gram or 1,000 milligram 3 times a day. Vitamin C has to be taken 3 times. So during cell proliferation, this is about cancer. If you have reduced glutathione level, the nucleus and the DNA that controls your cellular function will not be able to balance itself between proliferation and cell death. So this is a huge risk factor for cancer. So whenever you are low in glutathione, your risk of cancer increases. And cancer will deplete your glutathione. This is the reason why you don't fight cancer, because chemotherapy is not going to help you to kill. That is the reason why less than 3% of people with chemo survive cancer. You all know this, you know this, right? Most people don't survive because you are not healing the body. So glutathione, there is a pathway, some of you may want to just jot it down and go in Google. There is a pathway called NRF2 pathway. So what glutathione does is it activates this NRF2 pathway, which then activates your catalase and SOD. And as I've mentioned, one of the important function here is it controls or regulates the master inflammatory pathway signal, that is nuclear factor kappa B. For those, actually, I prefer that you just listen if you don't mind. You will absorb it better. If you want this, it's not in your notes because these are special lectures and Saham has to generate some kind of income, extra income to survive because this is a voluntary service. None of us take anything from Saham. So this lecture is available in the form of a CD which you can buy from outside. But buying the CD helps us to contribute better. Yeah, we'll be able to subsidize for more people to attend. One of the most important protection of benefits that glutathione offers is by protecting mitochondria, and I've mentioned everything in the cell happens with mitochondria, including aging. If you slow down your aging, you reduce the risk of diseases. The first slide I showed you that mitochondria is where your energy is produced and that energy is ATP. Every ATP molecule creates free radicals. So now we know that most diseases, including cancer, starts from mitochondrial dysfunction. So how do you protect the mitochondria from getting damaged? You must have enough glutathione. Yeah, and remember it functions by itself and it activates the other two antioxidants inside the cell. So glutathione is a source of sulfur because one of the amino acid in glutathione, cysteine, is a sulfur based amino acid. Do you all know that people who soak themselves in sulfur water, hot spring, they feel much better, right? Especially skin conditions, because it helps you to make glutathione. It is a cofactor in many of the enzymes in the body. It maintains the integrity of disulfide bonds. It's a little bit complicated. If I have a slide on the two types of amino acids, there's one called cysteine and the other is cysteine. I'll explain. I'm sure I have a slide. Now, glutathione is very important to repair and maintain good health of your DNA. If your blueprint is affected, then you are prone for disease. It transports amino acids across the cell membrane. How does it do? If you have free radical damage, the cell membrane, as I've mentioned, becomes hardened. When the cell membrane is hardened, you will not have your amino acids, which forms the basis for your enzymes and proteins and hormones. You won't make enough of this. And it also donates electrons in almost every possible reaction in the body, and it helps in the synthesis of many of your proteins. Prostaglandin is a very complicated system that helps you to maintain good health. Basically what it does is it takes care of almost every function in the body. So glutathione exists in two forms. One is the reduced form, the other is the oxidized form. When we say reduced form in medical term, it means it has accepted an electron, it is not a free radical. The reduced form is a free radical. If you have enough selenium, the mineral, then this reduced form, the oxidized form, will be converted to the reduced form. Easier. So you need to have enough selenium. Okay. So the reduced form of glutathione is the one that neutralizes your free radicals. In the body, 90% of your glutathione exists in the reduced form and only 10% exists in the oxidized form. So whenever you push the ratio of reduced to oxidized form to more of oxidized form, you will become sick. So how does it happen? Like for example, you sit for 8 hours, 10 hours here in this room, you breathe the carpet gas. You will shift your ratio to higher oxidized form. Then you become tired, you become sleepy, you have headache. But of course some of you are sleepy because you have eaten too much carbohydrates. You know why you feel sleepy after a meal? Simply because you have taken too much carbs. So the next time when we offer meals, don't eat a lot of carbs. But our meals are quite good, these are expensive meals. You can notice that we don't serve junk food. Yeah? So you can pay us more next time. Now, glutathione is made up of 3 amino acids. This is important to understand. One is cysteine, glutamine, and glycine. Now, if you look at this is cysteine, and you see the letter E. Okay. Now, this is an amino acid. The only problem with cysteine is it's not very heat stable. It can be oxidized. So, if you can make it heat stable, then it becomes a very powerful formulation. So, there are formulations that exist that has got another form of amino acid called cysteine, that is without the E. So, it's spelled as C-Y-S-T-I-N-E. It is simply 2 cysteine molecules in a disulfide bond that I showed you in the previous slides. So, it's very, very stable even up to 300 degrees centigrade. So, this is how understanding biochemistry and the modern technology helps us to develop better products. Okay. Another thing you should remember is glutathione should not be taken as glutathione itself, because it's a large molecule. It has to be broken down, reabsorbed, reassembled inside your cell. It's a lot of stress for the body. You should only take in the form of precursors, that means amino acids. So, whenever you have glutathione, see whether it is a precursor for formulation. And there are most of the formulations that offer precursors will have 1 amino acids. That would be cysteine. If you can get one with all the 3, then it is better. Is that clear? Okay.
How about if someone already has liver failure? Can we produce glutathione?
It is possible, because liver is an organ that is able to regenerate even 1/7 is left.
Okay.
Even say that means 7 parts damaged and just 1 part is left. It can still help in regeneration. And you cannot treat cirrhosis or cirrhosis of liver without glutathione. And what we do is, if we really want to heal this patient, sometimes we use intravenous glutathione. But we can't use intravenous glutathione on a daily basis. One is expensive, nobody wants to have a needle inside. And again, intravenous glutathione, it goes in, does its work, and is gone. Whereas if you have a precursor formulation, a sound formulation with all the 3 amino acids will work inside your cell 24 hours. So, you still need to use.
Okay.
Of course, you need other antioxidants. Vitamin C and alpha lipoic acid, vitamin E would be extremely crucial.
What is the formulation that has all these 3? Do you have any ideas? What is the...
I am not here promoting any particular products.
Your experience in using...
Okay. You ask me at the end of the lecture, I can introduce someone who can let you know about what product has all the 3. You can experiment. You are free to choose anything and experiment, but I don't think they are one of the exhibitors. But you can still find out what's the product. Yeah. Okay. Ask me at the end of the lecture. I'll tell you. So this is the difference between cysteine and cysteine. Okay, so this is a very important difference in terms of stability of what you have. So once the amino acid is stable, you can cook it, you can put it in hot water, you can bake it, whatever you want, it is still stable. Okay, but both amino acids, it's just the formulation. Cysteine, this does not exist in nature. In nature, you get cysteine, the one with E. But since it's not stable, the formulation is done in such a way that you combine 2 cysteine with the disulfide bond, then that molecule is known biochemically as cysteine. And that is the stable one. Okay? So this is how glutathione is made. It's a little bit complicated. You need this enzyme. You put together the cysteine and glutamine. Then your glycine is added, this enzyme need to be working for you to produce your glutathione. So there are 2 enzymes, 3 amino acids, and you need selenium.
Okay, so this is done so it becomes, is it a synthetic byproduct?
No, amino acids are natural.
Okay, so you combine the two together with.
No, we don't combine the enzymes. Enzymes exist in your body. It's just the raw materials that we need. And so I told you that every cell needs to produce glutathione, right? Now why do you need to take glutathione? Can anybody tell me? Since every cell produces glutathione from birth, from the time the egg is fertilized, you must have glutathione. If not, the egg itself does not develop into an embryo. That is how significant glutathione is. So why do you have to take any product, any supplement to increase your glutathione level? Can anybody tell me?
Too much of oxidative stress.
Very simple, yes. The demand outstrips the supply. Demand is much more than supply. So by taking enough protein, some of you may wonder, I have the amino acids, what? Eggs have amino acids, meat have amino acids, you will still get. It doesn't work that way. It is the ratio that matters. The ratio of glutamine to cysteine to cysteine, glutamine and glycine, and what form of cysteine. So if you have all the amino acids in the proper ratio, then you will have the ability to manufacture glutathione. Now the second point in taking a glutathione is, because glutathione is the master detoxifier, you must have in most people a form of healing reaction. So people tend to get a little bit off, sick in the form of headache or diarrhea, or maybe some tingling, some joint pains. That is healing reaction. It is not toxic. There are no known toxicity with these amino acids. It is safe even for pregnancy, breastfeeding mothers and children. It's just the dose that matters. So a powerful formulation will always have some kind of healing reaction in most people. If you don't have healing reaction in most people, then it may not be powerful enough. So glutathione is one supplement that causes healing reaction. Okay. There is another lecture that you will be exposed to. I am not sure whether it's module 1. It's called methylation. Please remember, just remember the word and you Google. Methylation is a hugely important process in your body, a biochemical reaction. When methylation is slow, it's just like finding a partner. Okay. In free radicals, it is donating an electron. Free radical trying to marry an electron. Here it is a simple carbon molecule. So when methylation is affected, your synthesis of glutathione through this pathway, the end product can be affected. So how do you know if your methylation is affected? Whenever you test your blood, ask your doctors to check your homocysteine levels and check your insulin levels as well. If your methylation is affected, it's a huge biochemical pathway. It takes a whole day lecture. Your homocysteine will be high. Just like high insulin, high homocysteine is associated with diseases from A to Z, including arthritis, cancer, Down syndrome, and on and on and on. So if your methylation is affected, you will have high homocysteine. Then you make less glutathione in the body, even if I give you the amino acids. So what do? Check your homocysteine. If it is high, very simple, just take B vitamins, especially B6, B12 and folic acid. So glutathione has to be reduced in the body. So it is hydrolyzed by your liver enzyme. And what happens is, when the glutathione is made inside the cell, when it is transported outside, it is done by the liver enzyme. It goes out in the blood and it is reassembled in the other cells to produce glutathione as well. So what I am trying to say is, glutathione works inside the cell, but when it wants to act in other cells, it has to be metabolized and transported into the cell. So basically what it means is, you need healthy liver. You need healthy liver to produce glutathione. You also need healthy liver to make sure the glutathione is used up by the rest of the cells in the body. So by keeping the liver healthy, glutathione helps in your systemic health. Okay? Phase 1 means the toxin is bound to a sulfur base basically. So it becomes a sulfur based complex, and in phase 2 it is made water soluble, so it can be excreted through your kidneys. So the second part of the detoxification in the liver, main control is by your glutathione. That is why whenever someone has a fatty liver or raised liver enzymes, when you use glutathione, the liver function improves. So deficiency is associated with premature aging and diseases. Let me go through some of the, we can skip this, we look at some of the diseases that we see. Now this is a study that we have noted a lot of information. Young and healthy people have highest level. That means you maintain optimum levels of glutathione, you slow down your risk of aging, and you reduce your risk of diseases. So young and healthy people have very high levels. Lower levels are seen in aging people. And when you see low levels, they are already sick. And when you see very sick people, those who are lying down in ICU with severe infections and cancers, and those who have burns and trauma, they have very, very low levels of glutathione. So whenever you have a patient who is sick, you cannot help them mostly unless you give them vitamin C and glutathione. Now you tell me how many hospitals allow you to do this. So it's sad, you know, it's sad. There is so much we can do to save lives. Only if you and the rest of the world can accept that the way to move forward is integrative medicine. I don't think I'll finish in 10 minutes. The president of the society always gets extra half an hour. Okay? Now I told you there are 100 types of diseases, about 100 types of diseases associated with glutathione deficiency. And you see some of these. Osteoarthritis. This is why when you have the right formulation and the right dose within a month or two, you will see improvement in arthritis. Even autoimmune disease. You saw my slides this morning. You all were there in the other room, right? It's very simple. Use glutathione precursors, vitamin C. Of course, it is with zinc and fish oil. Treat the candida. That's how I treat. Yeah, but the diet is important. And glutathione deficiency is seen in cancers, heart disease, Alzheimer's, Parkinson's, memory loss, cataracts, and AMD is adult macular degeneration. Why do you get cataract? It's oxidative damage of your lens. That is why diabetics have very high risk of cancer. Why? Because sugar is inflammatory. Diabetics have high blood sugar, right? So what happens when you take sugar or sugary food that is outside? You will get cataract. Next time you will not be able to see the lectures. Yeah? So having enough glutathione preserves your eyesight also. So many human diseases are associated with low levels of glutathione. This, the second point I've already mentioned. Oxidized glutathione can combine with another reduced glutathione to form a stable disulfide bond. What it means, now you have glutathione. It has already been oxidized. So you need to reduce it to be active again. You still need more glutathione. That is why you need to have glutathione inside your cell 24/7. You cannot have something that goes in, does the antioxidant work and disappears. That is why other antioxidants are not as powerful as glutathione. When you put the right formulation and the 3 amino acids inside the cell, it works 24 hours. So it is not good to take oral glutathione. It is not good to take IV glutathione on a daily basis. I take IV glutathione myself. I give it to my patients, but when I do the infusion. And I do not prefer a single amino acid. I prefer all the 3 amino acids.
What is the optimum dosage for glutathione?
If you take in the right formulation about 3 grams of the amino acids, yeah, anything between 1.6 to 3.2 grams of amino acids, the 3 amino acids, you should be able to make enough glutathione for a day.
3 grams each.
1.6 to 3.2, 3 amino acids put together. Extremely low levels are seen before death. So if you have someone suffering from acute diseases, increase the vitamin C and glutathione. So why we become deficient? Because we are eating wrong food from childhood itself. Whatever you have learned, please go and check if your child, if you have one, if not, get married and have children and take care of their diet. So this is a very useful tip for people who are intending to have children. Aging, you will have less pollution and radiation using handphones constantly on WhatsApp and Facebook at night, especially children. Parents don't talk to children anymore. The easiest way is to give them the handphone and let them play with it. Have you seen this? It happens everywhere. What are they exposing themselves to? IMF. Toxins and drugs, trauma, infection. So if someone has trauma, has burns and infection, you cannot treat them efficiently without increasing glutathione and vitamin C. Oxidative stress if you have poor detoxification. All this means you become deficient. Modern living, you need, the demand is much more than what you can produce. And if you have certain gene polymorphisms, some of you may not know these terms. Gene polymorphism means, don't call it an abnormal gene. Some of us have some variation in the gene. Almost all of us have some genes that are variant. They are called SNPs, single nucleotide polymorphisms. If you have these, your tendency to become deficient is more. Okay? You can do the gene testing. You can find out about 100 or 110 types of SNPs, and it will tell you the risk of what are the diseases you are at higher risk for. Whether you do or not, trust me, most of us are deficient, or all of us are deficient in glutathione. But doing your gene testing will give you better idea about the diseases that you are exposed to. So metabolically active tissues need more glutathione, which means your immune system that is working 24 hours, your brain that works 24 hours, now we know that brain needs 10 times more glutathione than the rest. That is the reason why you see more Parkinson's and Alzheimer's and memory loss now. Including children have poor brain health. So increasing glutathione levels in the children from childhood itself is the best thing that you can do to any child to enjoy better life. Liver, because it's constantly detoxifying, heart constantly pumping unless you want to stop your heart. You have to breathe constantly, and your kidney constantly filtering. So these are the organs that use maximum glutathione levels. So imagine how useful these are. It's not your muscles. Muscles use when you exercise, when you walk. When you sleep, you don't use glutathione for your muscles much. But these organs, even in your sleep. So aging, I've mentioned, is associated with glutathione deficiency. And when you have low glutathione deficiency, you have less ATP. Less ATP means less energy. Less energy means you become less active. So you become a couch potato watching TV all the time. What happens to these people? They become sicker. Okay, this is the reason why a right formulation of glutathione, within a week or two, you should feel increased energy. That's the first thing that you see. All toxins need to be neutralized. Whether it is the toxin in the form of pesticides, herbicides, heavy metals, all inflammatory substrates and neutralized cancer cells, they all need to be detoxified and thrown out of the body, and liver does this, and liver has one of the largest concentration of glutathione. So the first thing that you see in terms of blood results is an improvement in liver function test. And whenever someone has liver injury, you should always think about glutathione. This is xenobiotics. How many of you have heard about this? The problem with xenobiotics is most of them function like your estrogen. So for women, you have higher risk of tumors in breast, uterus and ovaries and cancer in these organs. For men, you have risk of prostate problems, cardiovascular disease, erectile dysfunction and impotence, abnormal sperm count, and you have no energy. And xenobiotics is one of the reasons why you can see young girls by the age of 9 to 10 having menses. It is not normal. Normal is 12 to 14 years. So xenobiotics, they can cause a lot of trouble for you. They can occupy your natural hormones and the receptors, and don't allow your natural hormones to work. So xenobiotic detoxification is important, and glutathione does that. Major phase 2 detoxifier, as I've mentioned. Now, significant decrease in the reduced glutathione is seen in cirrhosis. You asked me just now about liver cirrhosis. So whenever you have poor liver health, you are low in glutathione, which means you require more than a healthy person who wants to preserve health. So that's why sometimes we advise patients to take glutathione supplements twice a day, especially in this type of cases. Yeah. Anybody who is an alcoholic should increase the intake of any supplement that increases your level of glutathione. How many of you do blood test and you realize that you have high bilirubin levels? Have you noticed? I see quite often when you do your blood test, there's liver function test, right? There's one that says bilirubin. It is the bile, that greenish fluid. Now, stasis of that which becomes gallstone is associated with glutathione deficiency. 0 minutes. Are you all willing to stay a little bit longer for me to finish? Okay. Now, in liver injury, once a cell is injured, then it heals. The body is brilliant. It can heal. Especially liver can heal. Now we know brain also can heal. But it produces fibrosis. Okay? Now these hepatic stellar cells, those are the stellar cells in the liver, they proliferate after an injury because they are the ones who are responsible for fibrous tissue, because body heals by fibrous tissue. That is associated with scarring. So whenever you have an injury, these stellar cells in the liver proliferate and they become cirrhosis. And you want to control these stellar cells, glutathione does it. So whether your liver is healthy or it is sick, glutathione will still help. One in the prevention, one in helping the disease. You understand how? Because you know cirrhosis means the liver has become very hard, right? Because of fibrous tissue. You want to prevent, you want to treat, this is the way to treat. Sorry? It's not easily reversed once it's cirrhosis, but you'll see a significant improvement over time with liver function. That means the liver is healing and regenerating. That's the result, isn't it? So it involves many other pillars of health. The diet has to be good, you have to add other antioxidants, other supplements, and you can even use temporarily intravenous glutathione. And you need a lot of B vitamins, you need a lot of lipoic acid, you need a lot of vitamin E. But vitamin C and glutathione itself, you will see this improvement. Okay? And once you are trained in integrative medicine, nutritional medicine, you will know actually how to add more supplements. So consider this as the beginning of your knowledge. Yeah? Okay. Endotoxemia. It's a huge problem because there is a protein called lipopolysaccharide that is released from gram-negative. Now, this is a test that can be done. It's available in some of the tests. Now remember, whenever you eat high carbohydrate diet, especially sugar, if you have ever taken antibiotics, if a woman has taken contraceptive pills, if you are constantly under stress, you tend to have a lot of bad bacteria in the gut. And this bacteria can be gram negative. You have gram positive, gram negative. Now this LPS causes systemic inflammation. And this is the reason why when someone gets an acute infection because of systemic inflammation, they collapse. Okay? But what we have found is those who have enough glutathione, even if they have LPS, they don't suffer so much from endotoxemia. What it means, those who have optimum levels of glutathione, either you reduce your risk of infection. If you are infected, you reduce your risk of serious systemic disease. Am I making it simple for you to understand? Yeah? Is it any confusion here?
If someone suffers from leaky gut, can they benefit by taking glutathione or need to heal the leaky gut?
You can combine both. So I mentioned this morning that I will always treat candida if I see or suspect leaky gut, and you can combine vitamin C and glutathione at the same time. Yeah, it helps. And oh yeah, it's a separate lecture, but it's a beautiful lecture. So in the meantime, go to the Saham counter. There are books on candida, and there are also my lectures on candida. There are about 2 or 3 CDs. That would my advice to you all is start reading candida and gut health. So those who are interested can always purchase the CDs or book. If it is not available, place an order. Yeah, start there. Alcohol is an oxidative stress, so drinking alcohol, red wine, is supposed to be good. We always say egg is no good, then we say egg is good, now we say alcohol is no good, now we say red wine is good. It's up to you to decide. But for those who have regular intake of alcohol, optimizing glutathione levels will help. One of the main function of glutathione is immune system. Okay? As long as your immune system, this is how it functions, you can read from there, but as long as your immune system is strong, you will be able to fight bacteria, virus, fungus, and cancer. This is the reason why when you optimize your glutathione levels, you will notice that you are not so sick as often as you used to be. Everybody around you gets sick, including children. You will see an improvement. They do not get sick that often, simply because it improves your immune system. So you have an improvement in eczemas, sinusitis, frequent coughs and colds. It's not about vaccines. You are never deficient in vaccines. Your body is not crying for drugs. Your body is crying for something like this. Okay? So this is the second main function of glutathione. It just activates your macrophages and keeps your lymphocytes more active. In the body, I've mentioned this, you need 2 antioxidants that a combination makes it even more powerful. One is glutathione, the other is vitamin C. Vitamin C will help glutathione to recycle itself, but more than that, glutathione recycles your vitamin C.
Say that again.
Yes.
Can you say that again?
When you have optimum levels of glutathione, it recycles your vitamin C. You remember I said when vitamin C is an antioxidant, once it donates an electron to a free radical, this becomes oxidized. This must be reduced. So glutathione reduces this. Okay? And this helps glutathione also to get reduced. So they work as a powerful combination. They work in synergy. Yeah. And we humans from childhood, we are becoming acutely deficient in both. Children, because you can see the amount of antibiotics that they receive and the number of vaccinations, the amount of sugar in their diet, even bottled milk. So you are exposing them to glutathione deficiency and the inability to make vitamin C in your body. The biggest problem that faces now is the risk of cancer. That is actually the lifetime risk is 1 in 3, and by 2025 it could be 1 in 2. So look at how to improve your immune system to fight cancer. Okay? Intracellular antioxidant protects your DNA. It detoxifies carcinogens. If pesticide is a carcinogen, it helps to remove the pesticides from you. So if it is a xenoestrogen, xenobiotics, that's what it does. It does by increasing your immune system, recycles these antioxidants, and improves the sensitivity times up. Okay.
You're saying that
Yeah, I know. Thank you. Yes.
You're saying that young girls get menstrual cycles early because of antibiotics. Can we start them on glutathione?
You can, but you still have to look at where they get the excess estrogens and xenobiotics from. If it is from chicken and meat, if it is from plastic bottles, if it is from dairy products, if it is from deep fried food, if it is from pesticides, herbicides, if it is from chemicals, this is all the source of estrogen that I'm just giving you. So if this is the source, you take care of the source. But giving glutathione will detoxify the excess. There is no age limit, as I said. As soon as you are made in your mother's womb, you must have glutathione. So the only problem with newborns is difficult to titrate the dose. So what we say is, if you have a baby, why do you want to have a baby? How many of you are married and have children? Okay. Why do you all want to have children? Did they ask you to be in this world, or you wanted them to be in this world? So the first thing, the mother's role is breastfeeding, right? Unfortunately, we don't breastfeed. So when you have young children like this, you take glutathione while breastfeeding, increase your glutathione levels, so the baby will be protected. So how soon they can take? By 1-2 years. Maybe you have to use just a quarter dose because it is safe. There are no known toxicity. And from 6 to 12 years, you can take half the adult dose. General principle. 12 years and above, they take the adult dose. So young children, very young children and newborn babies, it is not toxic. It is just titrating the dose is difficult. So I had a baby, I was informed about this, where there was a baby with lots of mouth ulcers, 6 months old, can't even breastfeed. The mother just gave a pinch of the right formula, and after a few days the ulcers healed and the baby could latch onto the breast. So it is safe. Only thing, difficulty in titrating. So why would you want to do that? You might as well breastfeed the baby. Correct? Okay.
How can we check our glutathione levels?
You can even do the oxidized levels, but it's very expensive. There are a couple of labs that you can approach. One is Dr. DNA and the other is the Well Lab. Just find out who can do the test for you. I'm quite a simple physician. I don't spend a lot of money on certain tests. I might as well just treat the patient symptomatically. Something that everybody needs, most of us won't have enough. And it's an expensive test. You still want to check, you can check before and after taking a supplement. It will be even better to do that way. So this is all the mechanisms of how it protects against cancer. Now this enzyme is associated with bladder cancer, and this enzyme is associated with prostate cancer. If you look at GST, GSTM, these are all glutathione enzymes. So there are many ways that glutathione can protect against cancer. One of the best things that can happen when you have optimized your glutathione level is protection against viral infection. Let it be any virus. They can be killed by vitamin C and glutathione, as simple as that. You do not need vaccines, you do not need antiviral drugs, you do not need antibiotics, of course. You just need glutathione and vitamin C. So if I were to give intravenous vitamin C for dengue, just 2 doses followed by oral is sufficient to have the platelets normalized or at least uptrend. The same thing with chickenpox, the same thing with H1N1. You don't need the drugs. So one of the best things that can happen in countries where they are prone for malaria, HIV, Ebola, dengue, chickenpox, no, because that's supposed to be something that is better for you to get it, although we vaccinate the babies not to get chickenpox. That's a very bad idea. So this infections, protection against viral infection. So if you give it to patients, say with hepatitis B or hepatitis C, it will give you a tremendous health improvement. I have a patient, I didn't have time today to discuss. Now this guy has been having hepatitis B, and his viral count was 134 million plus virus. He has been on intravenous vitamin C, oral vitamin C. The count used to fluctuate. When we put him on glutathione, the amino acids, the last count was 368. Can you believe what is a powerful combination? What vitamin C alone could not do, glutathione and vitamin C can do. So 368 from 134 million plus, it's so much of improvement. So that's viral infection, any viral infection. How does it protect the heart? I mentioned, just to simplify, atherosclerosis means cholesterol in the blood vessel. Am I right? So does cholesterol kill you? No. Newborn baby has cholesterol. Your breast milk has plenty of cholesterol. It doesn't kill anybody, only oxidized cholesterol. How do you prevent the oxidation of cholesterol? Simply by having enough vitamin C and glutathione. Vitamin C because cholesterol floats in the blood, water-based. Glutathione because it protects the lipid peroxidation, the cell membrane itself. The lipid, cholesterol is a fat, so it protects. Then the cholesterol atherosclerosis is made up of calcium. Why do you get calcium in your blood vessel? You should only have calcium in your bones. Any one of you who take calcium without vitamin K2, you have a higher risk of atherosclerosis. So don't touch calcium unless it is a calcium with minerals, vitamin D3 and vitamin K2. So there are many reasons. It is not just cholesterol. So this is how it protects heart disease. It also protects heart disease by reducing the inflammation and removing heavy metals, and overall it by improving the systemic health. One way of reducing the risk of heart disease is glutathione improves your ATP. Heart just pumps all the time. It uses energy, and that energy is ATP. And this is the reason why when you give glutathione to congestive cardiac failure or heart failure patients, they see a lot of improvement. Okay. I don't think I have a lot of slides. I don't remember how many slides, but let's finish it. Now, brain is unique because it consumes 20% of the total oxygen that's available in the body. What does it do? When you breathe oxygen, you create what? Free radicals. So do you need to protect your brain? Brain is made up of 70% fat. When you have fat, it can be easily oxidized. What do you need to protect your brain? Glutathione. When do you start taking glutathione? Now you know it. So deficiency of glutathione is responsible for diseases like stroke, and it increases. You need to have an increased level if you have a trauma, if you are exposed to heavy metals, and the deficiency is also responsible for diseases like Parkinson's and Alzheimer's and memory loss. Okay? You need to, how to get yourself convinced about the benefits of glutathione. The superiority of one molecule is, go and watch YouTube, intravenous glutathione in Parkinson's. Probably you just have to Google that. Have you seen? If I were to give an IV glutathione to a Parkinson patient, within half an hour the tremors will stop or reduce and the rigidity is less and the patient walks much better. This is how powerful glutathione is. Of course, we can't use it daily because it's troublesome. Okay. So there are many reasons how Parkinson's is associated with glutathione deficiency. Basically, you have a lot of oxidative stress. Don't subject your brain to too much oxidative stress. You can't stop breathing. Oxygen will definitely be used. But don't eat the wrong food. And do not cook your food in aluminium cookware because Parkinson's is associated with aluminium toxicity. never buy aluminium foils. Yeah? And the worst thing to do is wrap your food in aluminium foil and put it in microwave. How many of you have microwave? Iron oven is okay. Alzheimer's, I have already mentioned. The reason why we have more Alzheimer's is glutathione deficiency. Number 2, Alzheimer's is now known as diabetes 3. Type 1 diabetes, type 2 diabetes, this is diabetes 3. And why? Simply because we are eating too much carbs. Okay? Depressed patients will benefit from glutathione, but first of all heal the gut, because your happy hormone called serotonin, 70% is produced in the gut. Okay? Schizophrenia and bipolar disorders. You can have very good results or in improvement in these conditions if you use enough, if you optimize glutathione with magnesium and omega-3 fish oil or krill oil. You give a good, okay, you optimize the level of glutathione in autistic children. You'll see the improvement within a month. There are many studies to show that, because autistic children are very low in glutathione. And do you know any vaccines that increases the risk of autism and dyslexia? How many of you all have given to your children? Yeah, because we don't know about it, unfortunately. But what you know now, you can help others to know. Yeah, whatever you know, it has to get better. When you have got better, you have to make it better. Do you understand this? So there is no stopping in learning and improving what you know. Yeah. In cough syrup, there is cysteine. A lot of cough syrups have cysteine as a mucolytic. The reason is because the cysteine helps your body to produce glutathione in the lungs. So because any lung infection, any lung disorder is associated with glutathione deficiency. So if you have a lung problem, optimize your glutathione levels. If you are low, you are more prone for infections. And someone who gets pneumonia, your immune system is almost zero. And that person is deficient or absolutely zero in glutathione, vitamin C and vitamin D3. Smokers especially will benefit. But when you give glutathione to smokers, please warn them that they will cough more for the first 1 to 2 weeks, because it is a healing reaction. How does it protect the eyes against cataract and macular degeneration? Is because both conditions are associated with free radical damage and from a high carbohydrate diet. You know why you bleed in, have you seen dengue patients bleeding from the ear, nose and mouth and all over? Yeah? What is it called? What is it called? Scurvy, right? And scurvy is vitamin C deficiency. So whenever you see even new vessel formation in your, the cornea, not the lens, some people have new vessel. We call it pterygium. Yeah. That is caused by vitamin C and glutathione deficiency and inflammation. Yeah. So do you need laser treatment? No. Okay. How many of you know about melatonin? Okay. It is the natural sleep hormone that your body produces, provided you expose yourself to sunlight and make your vitamin D3. Even D3 alone cannot give you enough glutathione. There are some things that are very, very useful for especially aging people. Melatonin is a natural sleep hormone. It is safe even in pregnancy. Taking melatonin will help you to protect against cancer, because it is a very powerful antioxidant hormone. It reduces the risk of nighttime hypertension. Glutathione and melatonin work in synergy. Okay? And when you have melatonin, it increases your glutathione production in the brain. So when you have someone with brain cancer, you must have optimum levels of glutathione. I told you about heavy metals. Mercury is very difficult to remove. There is a procedure that we do called chelation to remove heavy metals, especially lead. But mercury is very tough. Glutathione helps to remove your mercury. Okay? And mercury is very, very toxic to the mitochondria. You should have 0 levels in your body, but that's not possible because if you eat fish, you also get some amount of mercury. What is the best antidote for any toxins, any venoms? Snake venom, spider venom, whatever venom, human venom. A lot of humans now are venomous, sorry to say. Yeah? Because we have dissociated ourselves from the truth and living for truth or exploring for the truth. Everything exists within you. So when you deviate yourself from the self, you become venomous in some way. You know why? Because either your thoughts are wrong or your words are wrong or your actions are wrong. Correct? So, okay, leave alone human venom. If you have a snake bite or spider bite, the universal antidote is vitamin C. By universal, it means if you have a viper, you must have an anti-viper venom, right? But if I'm bitten by a viper, where am I going to look for anti-viper venom? Most hospitals and clinics won't have. So by the time I reach there, I'll be dead and gone. Vitamin C will neutralize any kind of...
Sorry, try to end. By 20. 21 are closing by 7.
Okay, okay. So this is the universal antidote. Yeah? I've been pushed to stop. I don't think I have many. Pesticides, it detoxifies, and that's it. You just couldn't have 1 second patience. So basically, what it means is that if there is one molecule, universal molecule in all your cells that helps you to protect 3 of the main functions in the body, immune system, antioxidant, detoxification. Optimize your glutathione levels, okay? And you can only do it effectively by taking the precursors, not by glutathione molecule itself, even if it is liposomal. Thank you very much.
Thank you very much, Datuk Dr. Selvam.